there, I'm Dr. Nancy Weber, and I'm an emergency room physician here in Lansing at McLaren Greater Lansing.
I'm Dr. Timothy Hodge, the Executive Medical Director of Emergency Services at Sparrow Health System. Today, even with the new Affordable Care Act, we have people who fall through the cracks. Without HP, they do not have access to health care. There are a number of people who actually may qualify at one point for the new insurance, but then fall out of qualification during the year and thus lose their insurance, and those people will need to be covered. We expect it for the expansion of Medicaid to cover up to 400,000 people, and so far it's only covered about 330,000 in this state. So we know there's still a gap there. Without IHP, these people do not have other things that will fill in the gap. There are no other insurance products for them. There's no other way for them to have real financially feasible access to health care. And we have to remember that health care costs for individuals is one of the highest reasons for bankruptcy.
IHP has had some incredible successes in controlling uncompensated care costs. They've been able to effect a 23% cost savings in their expenditures in the ED, reducing inappropriate visits.
We love to see the acutely ill and injured, but we would also prefer for people who don't need to see us to have access to primary care physicians, and IHP actually allows for that.
For those of us that have insurance, whether it's 75% of us, whether it's 90% of us, if enough people have insurance and are able to manage their diabetes, able to manage their hypertension, if you can get those people access to care community-wide, that can really make a difference. If somebody doesn't have health care, they're not getting their screening, medication, and control of these chronic health issues, and ultimately it ends up costing all of us, directly or indirectly. It's so much less expensive to manage things and avoid complications up front than it is to deal with the sequelae of untreated disease.
If my neighbor isn't healthy, then it actually affects me. Today, the world is so small. We have a pretty strong manufacturing system here in mid-Michigan, but that manufacturing system is based on health of a population, and the healthier my population is, the better it is for my community to compete with other communities throughout the state, throughout the country, and to compete with other countries.
Please vote yes November 4th for the Ingham County Health Services Millage.
It's a vote for a healthier community, a healthier Michigan.